I would like to start by introducing myself. My name is Rachel Stender. I am one of the Center for Pandemic Response Program Navigators through ANCA. I've been working with ANCA now for just about a year, and we've been going through this program, offering various technical services for our businesses and their employees, and this is going to be another one of these the sessions. We will be discussing health insurance and its availability and accessibility in the North Country today. This event will be recorded and uploaded onto ANCA's YouTube channel, so please keep an eye out for the post-event email that will include its link as well as access to the presentation slides. If you'd like to update your name and add your pronouns, you can click right on the participant button at the bottom of your screen, scroll over to your name, and then select rename. We don't have any scheduled break for this session, so if you need to step away from your computer at any time, please feel free to do so. We are going to have a time at the end for a little Q&A session. So at any time, please feel free to put any questions in the chat and we will answer those as we go through. But again, we'll have the question and answer session at the end. We have three presenters today. We have Debbie Hughes, who is a licensed New York State of Health Marketplace Navigator. She works through Excelis, and she will be speaking about both individual and family plan options for employees. We have Tish Biesmeyer, who is a Senior Benefit Advisor through Burnham Financial, and she'll be discussing seasonal employees and other special employee non-traditional health insurance options. And we have Rachel Karp, our Director of the Saranac Lake Area Chamber of Commerce, who will talk about the opportunities that the Chamber has for its Chamber members and the health insurance that they offer. And Debbie, if you want to go ahead and get us started.
Sure, happy to. Hi, I'm Debbie Hughes with Excelis Blue Cross Blue Shield, and these screens are going to walk you through the New York State Marketplace for health insurance, where I enroll everybody. Rachel, do you progress these screens or do I?
I will, yes. Just let me know when you're ready for the next slide.
Yeah, the next screen is fine. This one isn't that much information. So this is just an overview of what's in this particular slide, and I'll just speak to each one as it comes up. So we can go to the next one. There's nothing there that's, that's my mug. Okay, that's my contact information. So anybody can reach me, primarily my business cell phone, because it's like a part of my body these days. So just call me on that number. Next screen's fine. And yes, this is our mission and our vision. We want to make sure that we have a healthy community. And in order to do that, we have to make sure that everybody has health insurance. Accidents happen. I meet more people in the emergency room every day at the Adirondack Medical Center. It's amazing. They come in, they have to sign a self-pay consent. They do not have health insurance, and now they have a whopping bill. So it's really important that we reach out into the community, which is what we're trying to do today, to make sure that you have the information to pass on and the resources to give to your staff so they know how to reach us. My services are free, so it's well worth it. Next screen. Yeah, this is what I was just talking about. He probably came out of the emergency room. You don't plan these things. It's just life. It just happens. So at some point, it's just best to have the health insurance in place and to offset these costs, because some people are in that emergency room and it's thousands of dollars as soon as you walk in that door or right in on a stretcher, whatever the case is. It's a big bill. So yeah, I want to make sure you're prepared. So the next screen. This is a breakdown of just terms that people really don't know that much about. The premium obviously is your monthly premium that you're going to pay for your health insurance plan. The deductible is an amount that you have to pay before your copays kick in. You have to meet the deductible. And there's some lower deductible plans. There's no deductible plans. There's higher, depending on what tier of plan you enroll in, you will have a deductible to meet. And coinsurance is just a percentage of the healthcare cost that you're going to be responsible for paying. And out of pocket, each plan has something different to offer of what you're going to have to, what your benefits are going to be for out-of-pocket maximum. Next screen. And next screen. And this is where I feel at home. I'm in this screen like every day. So you can go to the next one. Here we go. Best place to just call me. Just call me. We're not meeting people in person anymore because of COVID. I'll take care of doing it online for you. I'm just going to need certain information from you, but I can enroll you in any of these plans: Medicaid, Medicaid Managed Care, Child Health Plus Essential Plan, any of the qualified health plans I can get for you through the marketplace. And you have an immediate, it's right away, it's immediate. You'll know what you're going to get enrolled in and what date you're going to be in, it's going to be active. So yeah, just call me. Next screen. Eligibility. This is important. It's all based on age. I handle the under 65 population. Household income and the tax household size is pertinent. That's how we determine what your subsidy is going to be from the federal government. And it's going to help you to pay your monthly premium on your health insurance. Yeah, nobody can be denied coverage. Pre-existing conditions went out the window October of 2013 when they rolled out the Affordable Care Act. And yes, kids can stay on their parents' plan until the age of 26. Sometimes it's beneficial to cut them loose because they're not in your tax household anymore. And usually kids, when they're younger, they don't have a huge income. It might benefit from you having them call me, or you can call me and see what they might be eligible for through the marketplace. It might cost a lot less money than keeping them on your employer-sponsored plan. And enrollment is all year long for any of these safety net products that are mentioned here: Child Health Plus, Medicaid, Essential Plan. Right now, qualified health plans are also year-round, but that's because of COVID. And I don't know when that's going to end. So anyway, next screen. Yep, next. There we go. Yeah, and birth to age 18, you're going to be Medicaid eligible. You're going to have Child Health Plus eligibility. After you hit the age of 19, you can also be in Medicaid. You can also go into an essential plan, but you do age out of Child Health Plus on your 19th birthday. So next screen. Oh, there's the cute baby. This just tells you the eligibility criteria. Like I said, I handle the under 65 population. Yes, you have to be a New York State resident, and we have to be able to make sure that we can find residents for you here in New York State. I have to be able to have a New York State driver's license, your social security card. If you move here from another state, you have to make sure Social Security knows that you're here and you are a New York State resident now. That's key, or I can't identity proof you. So next screen. Yeah, essential plan, fabulous coverage. It's a no deductible plan. There's no monthly premiums. They've just now, maybe a year ago, they started embedding adult vision and dental into the package. You don't pay anything. There's no premiums that you have to pay for this plan, and there's no deductible to meet. And you can see over on the right-hand side of the screen, it's great coverage. And most people take it here. You can actually go across the lake in Burlington. They will take the product as well. So you're well covered. Next screen. Yeah, this is just getting into the weeds of Child Health Plus. Across the top, the orange is the number of people in the household. As you scroll down, they're talking about income in that household. And then over to the left-hand side, it's going to tell you what your Child Health Plus monthly premium is going to be per child. If you have a family larger than 3 children, you're still only going to be charged for 3 children. So if it's going to be $9 a month, you're going to pay $27 a month for 3 kids, even if you have 5 kids. So it's really a great deal. Good coverage. So next screen. You can read here for yourself. The covered benefits are amazing. Everything is covered for these kids: medical, prescription, dental, vision. They can have all of the imaging done that they need, any lab work they need to have done, hospital, in-stay, primary care visits, emergency visits, specialists. It's all covered. It's all covered. And you pay 1 monthly premium. Again, I have to remind you, there is no copays with this particular plan. It's just a great plan for kids to be on until their 19th birthday. These are all the QHPs, all of your metal tier plans. Most of the ones I enroll in are the silver plan because it seems to have a deductible of about $1,300, most of them. The base and the bronze plans are very high deductible plans. Yes, they have a lower monthly premium, but for instance, bronze, $4,700 deductible, you're probably never going to reach that. It's not really usable health insurance. I call it catastrophic health insurance. It's just in case something big were to happen. A sicker population buys into the gold and the platinum because you can really go a lot of places with those products, but they come with a price tag. So next screen. Yeah. We need to determine your subsidy, and I think I spoke to that earlier in here. I need the tax household. I need the income of everybody in that tax household, and it will determine what I can take care of that for you through the marketplace. It'll come up immediately. It'll tell us what your subsidy is, and then we can start shopping for a plan for you, and you'll know exactly what you're going to have to pay when we're done with our phone conversation. I don't have to do an application. There is a screening tool I can use in the marketplace to just give you a, for instance, this is what it's going to cost you. You can chew on it, decide what you want to do with it, and get back to me. Do know that any of the qualified health plans do go by, and the essential plan, I apologize, the 15th of the month is the rule. You have to apply by the 15th of the month to be enrolled for the first of the following month. Again, this is just to break out family size, income guidelines. Again, into the weeds. Just have the employees call me and we can go through it all. It's pretty simple. Next screen. Yeah, so what we do. This is what we do every day. I'm going on year 16 now, but if there's an error, it's my responsibility. It's not yours. But I'm pretty familiar with this process. I do it every day. I try to remind my clients that I can't do what you do for a living. So don't feel bad that you don't understand the marketplace. It's my job and I do it every day. So I'm very well aware of everything that you need to know in here. So yeah, that's next screen. There we go. There we go. What makes us different? Well, we are a free community resource. I already told you my services are free. You do need to know that I work for Excellus, but I am certified by the state to enroll you in any plan that's in the marketplace. So it's what you want. I'm here to assist you in this, but I can enroll you in any plan that you want. So we're going to find something that fits your pocketbook and fits your needs. Next screen. Well, I guess we're going to do that at the end. So, okay.
Yes, I think that would be best. We'll save any questions. You can always put them in the chat, but we'll save the rest of them.
We do actually have one question in the chat for Debbie, if that's okay. Julia is asking, what is 100% to 400% of the federal poverty level?
Oh, those are just the weeds. Those are charts that the state puts out. It's going to tell you exactly what your subsidy is going to be, or if you're going to be free insurance. But again, I need the head count in the household and I need the gross income. So once I have that information from you, we can go over all of this. It's very easy.
And those are also here in the slides.
Yes, they are. They are.
And we'll be sharing this.
You can read them.
Yeah. We'll be sharing the slides out later as well if it's easier to see.
Yeah, I'll go over all that on an individual basis.
Great.
Yep.
Great. Okay. Next we have Tish Wiesmeyer, who is the Senior Benefit Advisor through Burnham Financial.
Okay, well, thank you, everyone, and I'm glad to be here today. Who are we? We are Burnham Benefit Advisors. We're located in Lake Placid, and we are brokers. So I don't work for any one insurance company. We are there to help our clients from small to large firms and help you access and provide resources for you regarding the best benefit package that meets your needs, your budget, and so forth. Very similar to what Deb does at Excellus. We have 3 pillars that we really pay attention to, and that is cost containment. What is the best plan for you? best plan that's going to meet your pocketbook, your needs for your employees, making sure we communicate those employees through employee appreciation, and making sure that administrative efficiencies are available, because most small businesses in the North Country don't have an HR department. So we try to take a lot of that burden off your plate, and we have resources that can help our clients with those areas as well. Next slide. So our agenda here is we're going to do a little overview of cost containment, employee appreciation, administrative efficiencies, and then also, next slide, talk about what we can do for like seasonal employees, J1, and so on. So next slide. Okay, so this is just, Burnham, we are now part of Alara, which is a national brokerage firm. So we have all these new resources that are available to us for our clients. And again, like Deb's services, we do not charge any services. You do not pay a higher premium when you use a broker. It's the same as if you went out in the marketplace on your own. We're just there to help facilitate and help make recommendations for you. Next slide. So when we're talking to an employer, the biggest thing is how do you control costs? Because health insurance goes in one direction, it goes up in cost every year. It's very rare that it ever goes down. So we try to do pre-renewal forecasting with our clients, provide you with insurance carrier updates, who's available in the North Country, who tends to be the most popular provider, and why they are, and what the pros and cons are. We have solutions for part-time and seasonal workers. There's Healthy New York, which Deb brought up. We try to help educate and also refer many of our clients to someone like Debbie. And then also we have areas of individual Medicare that post 64, age 65 plus, and help guide people in those directions for Medicare. Next slide. So again, area of focus, employee appreciation. If you're providing benefits for your employees and their appreciation is at a 5 on a scale of 1 to 10, you're losing lots of benefit dollars, and we want to make sure that employees understand how the plan works. So we really focus on direct connections with employees. We have a customer care card. There's a little copy of it there. It's like a little credit card that we do benefit and claims workshops for individuals. Given COVID, we meet a lot of times with employees after hours, Zoom call with the husband and the wife, what have you, if they're not sure about how something works. So we are sort of a one-stop shop for helping employers not only find the plan, but also being the support for their employees of how to navigate the benefits of getting the best bang for their dollar. Next slide.
There we go.
Okay, so administrative efficiencies, again, most of the small employers, even large employers, don't have a dedicated HR department. So we try to help assist and guide people with COBRA, any transaction issues with bills for adding and deleting, helping people with notices and what they need to get to their employees. There's all these requirements also that employers have to do, like sexual harassment training. We have a lot of tools available to our clients that they can use for training purposes, and it's just part of our broker services. And we're very compliant. We have newsletters that go out on a monthly basis, keeping you up to snuff, up to speed of what's available in the marketplace, what the trends are, what employer requirements are, what's coming down the pike, etc. Now, given the Great Resignation, employers are having a hard time finding employees, and especially like in the seasonal time of year, a lot of employers are like, I can't get people to work. So one differentiator is there's a new solution. We use it through Revive Health. It's a product. It's a health benefit. It's not health insurance. It's a great product for part-time and seasonal employees. It's a way to attract and maybe retain those folks for a period of time. It's a very inexpensive benefit. So it can help reduce absenteeism, etc. Next slide. So what this benefit is, and given COVID, more and more people were going and utilizing telemedicine, not only for primary care, non-emergent issues, they're also using it for mental health. This is just taking it one step further. Revive Health Plan is you have virtual primary care. You are designated at one doctor. It's not a PA, it's an MD, licensed in New York. There's no cost for any of your primary care visits. You have mental health visits that are available to you at no cost. There's a large range of prescription drugs, up to over 500, I think, that you can get at no cost. And then they have a cost tiering system. They have discounts to labs and so forth. And there's a wellness component. Next slide. Oh, let's go back to that other slide for a moment. The cost for this plan, I didn't put in here, but we're looking at something anywhere from like $40 a month to $25 a month, depending on which plan that you take. A lot of times employers will buy this and piggyback it with a high deductible health plan where there's that large deductible of $4,000, $7,000, what have you. This is a great benefit to overlay that. It's inexpensive and it provides you with first dollar coverage. Whereas with a high deductible, it's for that catastrophic situation. At least you can get some of your routine care and non-emergent care available to you at a very, very low cost and zero copay for these services. Next slide. So also, we have a tool that a lot of our groups take advantage of. It's an HR tool called Think HR. I had someone ask me a question today, can a 15-year-old seasonal worker work in a maintenance office? I didn't know the answer. I thought I knew the answer, but I sent it off to our experts and they sent it back, and it was an interesting answer. It was the best case, they give you the best practice answer, and they cite where all those decisions and advice comes from. And we use it for all sorts of, employers are using it, an employee left, what are my rights here, et cetera. So we have this long range of services that can help take away the burden of administrative tasks from the HR person who's wearing the hat at the business. Next slide. So compliance is another big thing. There's compliance. There's more compliance that happens, not less. So we are direct access to our groups with that. We have binders that make sure to keep you bulletproof. People do get audited. There's human resource support, and we make sure that you have all the right filings and submissions depending on what type of health plan that you have and so forth, and make it relatively easy for you. And also we provide the summary plan descriptions, which a lot of groups forget that they need to have. And, we do all those things. It's just part of our broker services. Try to make your job a little bit easier. You run your business. We know how to take care of that. Echoing Debbie's words, I do this every day. So it's not as daunting to me, where for many people who don't, it's great to use someone like myself for these services. All right, next slide. So, where do we go from here? We are employee benefit specialists. We have time-tested and proven diligent process. We have clients that range from groups of 5 up to 500 up to 2,000. Our approach is 3 prongs: cost containment, employee appreciation, administrative and compliance support. And we do have access to individual health plans and Medicare options. However, I definitely would refer people mostly to someone like Deb, because I think they are the better experts in those areas and are more comprehensive. So we kind of work together too, in those arenas. Again, there's no fee for our services, and we're compensated by the insurance carriers. And that's it.
Thank you so much, Tish.
You're welcome. I was glad to present.
Our next presenter is going to be Rachel Karp. She is the director of Saranac Lake Chamber of Commerce. Welcome, Rachel.
Thank you. And thank you to Inca's CPR team for having me here today. And I am certainly not an expert on health insurance, but we are able to provide health insurance services to our members through our partner chamber, the Plattsburgh North Country Chamber of Commerce, and the in-house brokers at Plattsburgh North Country Service Corporation. These brokers are available to speak to our members at any time and frequently take appointments and hold open houses at our offices. Next slide. There are 2 full-service brokers available that specialize in small business health, dental, vision, and life insurance policies. They also assist sole proprietors and owners in acquiring individual health insurance for themselves and their families, both on and off the New York State marketplace. The brokers are certified New York State marketplace navigators, and we are able to cover businesses and employers of all sizes, individuals, self-employed people, nonprofit organizations, churches, and more. And plans are available through all of health insurance carriers offering services in the surrounding counties, including Clinton, Essex, Franklin, Hamilton, Warren, Washington, and St. Lawrence counties. Next slide. So I work closely with Lisa Bedard-Dupy, who is the Director of Health Insurance with the North Country Chamber of Commerce in Plattsburgh. And if we have members of our chamber who are interested and in need of health insurance, I connect them with Lisa. She is qualified and licensed to assist businesses with insurance needs, both on and off the New York State of Health Marketplace, including these listed here: Blue Shield, the Capital District Physicians Health Plan, Excelis Blue Cross Blue Shield, MVP Healthcare, Healthy New York Small Business Policy, and Davis Vision Plan and Guardian Dental Insurance. Examples of the plan prices and details can be found at gochamberhealth.com, but they are just that, examples. Prices and options vary depending upon your business size, your location, and so for a personalized quote, we highly recommend you connect with us and contact Lisa. Next slide. As an added bonus to our members, the Chamber holds large group dental and vision policies. Individual members and businesses are welcome to enroll. The plans are available to the businesses and their employees to enroll in. And these plans give small businesses access to large group rates and extended benefits. There's no minimum enrollment and no waiting period for benefits. The dental plan is written with Guardian, and the vision plan is a Davis Vision Plan. And also understanding that we live in a remote area and finding in-network providers is sometimes difficult. There's also an upgraded plan with extended out-of-network benefits available. And again, applications and additional information about these plans are available at our offices, Saranac Lake Chamber, as well as the Plattsburgh Chamber of Commerce. Next slide, please. So as I've mentioned, these insurance benefits are available as a chamber member. So if you're not already a member of the Chamber of Commerce, we would certainly invite you to join. We have membership levels for businesses, nonprofit organizations, and as a community member. And we do have community members who pay for a membership to be able to have access to that dental and vision health insurance plan. And also, I know we have a variety of businesses, individuals here today. So if you're a member of another chamber in another area, the North Country Chamber of Commerce partners with many chambers to be able to provide these benefits. Next slide. So we will be releasing dates soon for appointments in the fall to discuss health insurance options and enrollment and renewals for businesses and individuals for 2023. Lisa from the North Country Chamber does come to the Saranac Lake area. Typically we have an open house day where she comes and meets with businesses, sets up appointments, and will also go to individual businesses. If you'd like more information or to make an appointment sooner than that, you can certainly connect with us. We can also help you contact Lisa directly. Her contact information is listed there. And if you're interested in becoming a member of the Saranac Lake Area Chamber and want to find out more about how your membership connects you to these benefits, I'm happy to talk to you a little bit further about that. You can also visit us on our website at slareachamber.org. And we are very lucky to be able to partner with the North Country Chamber to offer these insurance options and benefits. And I'm happy to answer any questions that there may be. On this slide, you'll see the helpful links, including that Go Chamber Health website that has additional information specifically about health insurance. Thank you.
Thank you so much, Rachel and Tish and Debbie. I really appreciate your time and offering this to our businesses and their employees. Does anyone have any questions they would like to ask any of our presenters today?
Rachel, we do have a few questions in the chat that came in as folks were presenting. I'm trying to scroll back here.
Okay.
So one was, please define what annual income means when we're talking about insurance.
We're looking for the annual tax household income. So it's going to be what's on line 11 of your 1040 is what we're looking at. Everything's based on that. Your subsidy, what your monthly premium is going to be, everything is based on that number.
I think the next question was for Tish.
Right.
And
SPDs?
Yeah.
Yes, if an employer group is required to provide a summary plan description to their employees, and if we're your broker and we do your health insurance, dental, vision, we do prepare those SPDs for you for distribution to your group, and it's based on the health insurance plans, dental plans, whatever is an SPD eligible benefit, life insurance, LTD, etc. We do those for our groups. It's part of our service.
There was another one from the same person that says, are Medicare eligible participants allowed to enroll in Guardian Dental?
Yes, I believe so. And I think that was from Julia. I'm happy to touch base with you with a more firm answer from Lisa from the Plattsburgh Chamber.
And then there's another good question in here that says, we've heard from 3 great presenters today. Where is the best place to start as a first-time business owner?
Well, I'm gonna say that it depends on I guess what you're looking to provide. I think that if you are interested in assisting your employees with the type of coverage and what they're going to be paying, Tish or Rachel would be your best option for that. And then if it were just going to get your employee in touch with someone who can help them enroll in insurance that you aren't able to help pay for, then Debbie would be your best contact. Correct me if I'm wrong.
There's a lot. I think you're right, Rachel. Thanks for mentioning that. For a first-time business owner, there are certain programs like Healthy New York that you may qualify for, and you get a substantial discount for health insurance on those plans than you would if you were just to buy a non-Healthy New York benefit. So that's a terrific option for a great way of attracting and retaining people, because frankly, that's the first question they ask: what do you provide for benefits?
To kind of elaborate on that a little bit, I think that based on my experience and working with health insurance, which is not nearly as extensive as these presenters, but I would say that Tish and Rachel would be a great resource for any business owner who has questions about a policy for themselves along with their business. And Debbie would be a good resource if your employee came to you and said, I just lost my health insurance coverage. I know you don't offer it to us. Where can I get health insurance? So we can go to Debbie as just an individual person to ask, to obtain health insurance. Whereas through the business, I would say Tish and Rachel would be a best option, because then they can compare what is available for multiple families, if that makes sense.
Thank you, Rachel. And to clarify with that too, are there benefits for getting insurance through the business versus just sticking with an individual plan, or there's ways you have to do it either direction? And stop me if I'm getting too into the weeds here.
No, that's a great question. And I think that's where Tish and Rachel would come in great, because they'd be able to compare, because they can also do individual plans through
Right.
their business, that they would be able to compare those rates and give you what would be best for you.
Generally speaking, providing it on a business level is the best way to do it, because of for tax reasons and coverage and better discounts.
Okay.
Just to step in here, it depends too on what kind of business you are. If
Yep.
you're a C corporation, your benefits and tax deductibility are completely different than
Yep.
if you are a LLC or sub S.
Yep.
Okay, great. Thanks, Julia. Thanks, Tish. Thanks, Rachel.
Does anybody else have any questions?
I have an unrelated but related question, and that is with the New York State requirement to have an IRA or retirement plan in force for all employers. Are you planning to put together a similar panel for retirement plan solutions for small businesses?
We had not, but that's a great idea. We will definitely look into that through the CPR program to offer that in the future. Thank you for bringing that up. That's a great idea.
This is something that I know something about, so I might be able to assist you finding providers or whatever. So
Great.
You guys have my contact information. The New York State stuff doesn't have an effective date yet, but I would just hate to see employers get caught short with requirements that are, in my opinion, stupid. But that's our state in action.
Yes, thank you so much for bringing that up. That's very valid, and it would be great to get people information so they just have it before things come landing on their lap, to at least have an idea of what's out there for them that can assist them. Thank you.
Yep.
I did have a couple of questions that I just kind of wanted to follow up with. Debbie, just to clarify, when you said that children, I should say your children can stay on insurance through 26, does that still have the stipulation whether they're enrolled in school or not?
No, I can answer
Again,
that.
I'm having problems hearing. It's all breaking up. I can't hear you. I apologize.
Oh, okay.
The age 26 is the Affordable Care Act requirement. It has nothing to do with school.
Okay, I know at some point there was, so I just wanted to clarify that. And then the next question I had, and this could really be answered. Does anybody know at what age a child's income, and is it 18, can become counted as income into the household?
For what purpose? Taxes or something else?
For health insurance. And I guess it would be based on your taxes also, because of the health insurance goes based on your annual income. So if if your child works a full-time job through the summer and makes $12,000, when does that become part of the household income? At what age?
You have to count it. I take income from 16-year-olds, 17-year-olds. It's part of the tax household income. You have to count it.
That would be my question. Thank you. And those are the only questions I have. If anybody else has anything they would like to.
I just wanted to mention this note that Zach from ANCA put in the chat in case folks aren't looking at the chat. He just had a good reminder that if you live in a place other than the Saranac Lake area and you want to see if your chamber offers health insurance, we can help find those people and connect them for you. Or if you have a different situation that you need help kind of just navigating, we are happy to help you with that. So you can reach out to us and we'll make sure you have all of the contact information for our presenters today, as well as us at ANCA. Oh, yep, there they are right there. So if you want to take a screenshot, and we'll also be emailing them out to all of you afterward with the recording and the slides too in another day or two. So we're here to help.
Well, thank you so much, everyone, for joining us today.